Hi, everyone. My name is Allison Scott, and I'm the Director of Impact and Innovation at the Campaign for Southern Equality. My pronouns are she and her. Before we begin tonight's presentation, I just want to say how much we truly appreciate all of the organizations and our partners in Ohio who are the face of what is going on and will be the people that most of you will reach out to in the coming days to get your questions answered and to help find treatments for care. Those groups, in no particular order, are the ACLU, TransOhio, Equality Ohio, and also coming from Kentucky is the Kentucky Health Justice Network. Now, I'm going to start it off and turn it over to the ACLU to talk about the litigation and possible outcomes.
Hi, thank you, Allison, and hi, everyone. My name is Sean McCann. I use he, him pronouns. I am a policy strategist with the ACLU of Ohio. So we are the state affiliate of the national ACLU, the American Civil Liberties Union, which, as I'm sure many folks know, fights for all of our, civil rights, whether it is transgender folks' ability to access care and to, frankly, to live their lives, or whether it is access to reproductive care. We are on the scene. So yeah, just a quick kind of, I'm sure many folks know already the provisions of HB 68 and kind of the ins and outs, but just as a refresher, it unfortunately in 90 days from yesterday will ban the initiation of gender-affirming care for minors, including puberty blockers, hormone therapy, and surgery. And of course, as folks might know, the governor also issued his emergency executive order that also banned surgery for minors. And now, notably, as folks have already alluded to in the chat, there is an exception for minors who have been residents of Ohio by the time the bill will go into effect. So that's a 90-day window that we're looking at from yesterday, like I just said. So these youth should be able to continue to receive care from their current provider once the bill does go into effect on April 23rd. And it is important to note that unfortunately this exception excludes youth who may have been receiving care in Ohio, but who are not residents of Ohio. The bill specifically uses the language residents of Ohio. So we can go ahead to the next slide. And so I unfortunately do not at this point have any specifics to share with you all about litigation, at least from the ACLU of Ohio's end or the national ACLU's end, but I can tell you that our legal team and the legal folks at National ACLU have been watching HB 68 since its introduction, have been tracking it very closely, having conversations, and are certainly evaluating all of their options at this point now that the Senate has overridden HB 68, HB 68's veto from the governor. So just please know that, our legal team is looking at this very closely, in addition to the administrative rules proposed by the governor, both the emergency rules that are in effect and the proposed rules that are going through the public comment process right now. So and as folks might know too, certainly there's been action in other states, and we've got kind of a set of circumstances in Ohio that is unique to us. So it's what's happened in other states might not always be indicative of what happens here or in the Circuit Court of Appeals we are in. So with that, happy to turn it back over to you, Allison.
Thank you. And just real quick, I want to apologize to our lovely partners with Kaleidoscope and Fairness Ohio. Just want to make sure we recognize them. Totally my fault. So now that we're getting past my mistakes and boo-boos, thank you for the ACLU. We're going to move on to the next part of our agenda, which is the Equality Ohio.
Good evening, everyone. My name is Yvonne Boyd-Nelson. I use she, her pronouns. I am the co-interim executive director of Equality Ohio. Just thank you, everyone, for being here this evening to get this information and to remain engaged in this important work. Equality Ohio is absolutely continuing our work to both support LGBTQ Ohioans, to support access to healthcare for LGBTQ Ohioans, and all of the other work that we have been doing, will continue to do in spite of this result. So Sean mentioned the proposed rules that are right now before the Ohio Department of Health and the Ohio Department of Mental Health and Addiction Services. And we want to remind folks that there is still time to comment on the rules that were proposed by to the Ohio Department of Health. That deadline is February 5th. I believe my colleague will put in the chat a portal that has been provided by NCTE, our friends at NCTE. Thank you so much for that, the National Campaign for Trans Equality. And that is going to be an easy portal that's going to allow you to submit your comment directly to the Ohio Department of Health. If you have previously used this portal to submit your comments prior to the January 19th deadline, do know that your comments went to both agencies. However, because the rules are different, if you would like to submit a separate comment to the Ohio Department of Health, that is absolutely okay, and you can do so through that portal. We also have some information available on those comments, on submitting comments, and why your voice is so important in this process. We want to make sure that the voices of Ohioans are heard, the people who are actually impacted by these proposed rules, the providers that are actually impacted by these proposed rules. So please, if you have not yet, please make your voice heard. Please do use that portal to submit your comments. I do want to remind folks that Equality Ohio is still here and still remaining vigilant at the State House. Despite HB 68 passing and the veto being overridden, there are a number of other pieces of policy that we are watching, and so Equality Ohio remains vigilant at the State House to watch other pieces of anti-LGBTQ plus legislation. We don't have any updates on any of those pieces of legislation. As always, we are going to keep you updated as soon as we hear anything, as soon as there is an opportunity to make your voice heard and to be involved in the process. Please note that we don't believe any less in the idea of civic engagement and in the idea of Ohioans being civically engaged in these processes. And so we are going to continue to invite your engagement in these processes moving forward. I also want to remind folks that we are continuing to work at the municipal level. So though we are seeing these negative things happen at the state level, opportunities continue at the municipal level. So if you are in a municipality, if you're a municipal leader, if you are a community advocate who believes that there is space for positive things to be happening at the municipal level, please do reach out to us. I want to note that we have a legal clinic, the Equality Ohio Legal Clinic. While we don't provide service in this particular area, the clinic is available to provide referrals. They are aware of a number of different helpful organizations throughout our state that can support LGBTQ individuals and families in this moment. And as we are all trying to chart the path ahead. So please do reach out to the legal clinic at our 188 number or online where our intake form is. And then I want to remind folks that we're going to have our annual scorecard later this year, which is going to be a reflection of all that we have seen in the 135th legislature, including this unfortunate result with HB 68. Equality Ohio is going to remain a place that you can come to for information. We are here to provide resources, to convene folks who want to help. And we want you to reach out to us with your ideas. If there are ways that you believe you can help, if there are ways that you believe that we can be doing more for the community in this moment, we are all ears. So please do reach out to us with your questions, with your ideas, and in any way that you can get involved in the other things that I mentioned. Thank you. Allison?
Thank you for that. Now we're going to go to Emma from Campaign for Southern Equality.
Hi, y'all. As Allison said, my name's Emma. I use she, her pronouns, and I'm the communications and policy manager at Campaign for Southern Equality. I'm going to be sort of walking us through the Southern Trans Youth Emergency Project in Ohio and the resources that we're offering. We're very proud to be partnering with Equality Ohio, Kaleidoscope Youth Center, in TransOhio on this project. I want to acknowledge that this is CSE's first time doing work in Ohio, but that we've launched this program in every state in the South with a gender-affirming care ban, as well as Missouri. And we've built a really strong network of providers and resources in the South and the surrounding regions. And we're excited to be able to share that with folks in Ohio, and as well as, folks who get their gender affirming care in Ohio. Yeah, so we're really honored to be y'all's neighbor and to be working on this project. Next slide. Okay, so these are sort of the 4 buckets of resources that are offered through the Southern Trans Youth Emergency Project. So the first is patient navigation. We have several patient navigators on our team that can help connect you with gender affirming care in a safe state with a provider that works for you. So what that looks like is you'll fill out a form on our website, which I'll talk about more. I'll talk more about how to access that form in a second. And then someone will reach out directly to you and get on the phone with you and talk you through what provider will work for you and connect you with that provider. We also offer emergency grants of $500 to families of trans youth who have lost their gender affirming care. These grants are not restricted in any way. They can be used for the cost of travel to a provider, for mental health care, really for anything that you or your child need at the time. And for those 2 resources, parents of trans youth, parents or guardians, can access those at southernequality.org/OH resources. Once you're on that page, there'll be a form for you to fill out. And once you fill out that form, as I said, the patient navigator will reach out directly to you. If you live in another state, not Ohio, you can go to southernequality.org/STIUP. And if you live in a state that we serve, you can find your state on that page. And finally, if you live in Kentucky, it works a little bit differently. Kentucky Health Justice Network actually does the patient navigation piece of the work in Kentucky. You can connect with them through our website, and they also have a link on their own website that you can also connect with them through that. Okay. Moving on to these other 2 buckets of resources. So we provide frontline grants to local organizations that are working directly. Oh, can you go back to the last slide? Sorry. Oh, but yeah, there you go. Yeah, so we provide frontline grants to organizations that are working directly with trans youth. And then finally, we aim to sort of create an ecosystem of care for trans youth. So this really involves collaborating with partners and providers and organizations in states to sort of ensure that trans youth still have support even in the wake of these bans. So we do that in a variety of different ways. These town halls are one way. We do healing and resilience workshops for youth and families. And then we also try to collect resources and distribute them. So we have a resource guide that includes a list of different organizations that provide resources to trans youth in Ohio. And since we're new to working in Ohio, we would really love y'all's help with that. So I'd love if someone could put the link to that document in the chat. And if anyone has any suggestions on resources or organizations that need to be added to that, please let us know. It's really a living document and we need your support and we appreciate your support. Okay, before we move on to the last slide, I know this is kind of a lot. I also want to mention that TransOhio is also providing emergency resources for trans people in Ohio. And I think they're going to talk more about that later. So these are just the resources being directly offered through the Southern Trans Youth Emergency Project. Okay, next slide. Awesome. So yeah, immediate next steps. If your child has started gender affirming care, we're really encouraging folks to reach out to their current provider as soon as possible. Every provider could be interpreting this new law a little bit differently. So it's really important to make sure you know how your provider is going to proceed in the wake of this law, if they're going to continue offering care or not, and who they're going to continue offering care to. So we encourage you to reach out directly to them on that. If your child has been considering starting care but hasn't yet started a course of treatment, or in any other situation where your child is not going to be able to continue getting care from their current provider, please reach out to TransOhio or the Campaign for Southern Equality as soon as possible, in the ways that I previously mentioned, and we will do our best to point you in the direction of a provider that can fit you in for an appointment before the 90 days are up. Next slide. Yeah, and finally, I just want to encourage y'all to please share out these resources. We have a resource, sorry, not a resource guide. We have a social media toolkit linked in the chat that can be used to share information about this program on Facebook, Instagram, Twitter, email, direct message, however you reach out to people. We have a template for you to talk about these resources. And yeah, we really appreciate y'all helping get the word out about this.
All right, thank you, Emma. Now we're gonna go with Kaleidoscope.
Thank you, Allison. Good evening, everyone. My name is Erin Upchurch. My pronouns are she, her. I am a social worker and the executive director of Kaleidoscope Youth Center, also known as KYC. We are a statewide organization serving young people, LGBTQI+ youth and young adults ages 12 to 24. And we additionally have programming for 12 and under monthly and work with parents and guardians. I first want to just assure and affirm, Kaleidoscope is still doing all the things that we were doing before this passed. We are still providing care. I have listed here some of our programs and services, which you can find a more comprehensive information on our website. But we do have our drop-in center, which is Tuesday through Friday, and I believe some of our young people are there now watching this. That's for ages 12 to 20. We do have our parents and guardians group and our 12 and under group, which I said meets monthly, which is a really good time for young folks to come together and play and have a good time. If you go to kycohio.org /center, we have an entire calendar there for the month. And so it will indicate what time and what days and what different programming is going on. We also have emergency housing. Our housing programs have been around since 2019. And our emergency housing specifically is for queer and trans non-binary young people who are finding themselves in need of a safer place to stay. We know that often shelters are requiring different definitions of homelessness. And we are very, 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 very much the least restrictive opportunity that I'm aware of in Central Ohio. And so I know as different things are going on with young people now with these laws, and we also know that for our young folks, family rejection is the number one reason for homelessness. I want to make sure you all know that we do have that resource. We also offer behavioral health and community support. We have a department of behavioral health and clinical services. So we've got therapists or counselors. We are not going to be changing our care that we provide in terms of our therapeutic work and our support groups. And again, that information can be found on our website. And then in terms of support, we have a specific email that we've put together to offer support for families of trans youth. And that is, to direct you to this project if you are in need of some patient navigation and maybe you can't find the website or you're feeling overwhelmed. You can email that support@kycohio.org, and then we are happy to help direct you to these resources and any other ones that might make sense. And the last thing I want to note is a save the date. We are working in partnership with a lot of people across the state, which is a really beautiful thing. But with NASW Ohio and one of our board members, Lee Tepper, who I believe is on here, to develop practice guidelines for social workers and mental health providers. There will probably be a better title for this, but please save the date if you are a practitioner, a mental health provider, for Friday, February 23rd at 12. It'll be via Zoom, and of course at no cost. But it'll be an opportunity for us to kind of troubleshoot, problem solve, but also offer some guidelines, some supportive language, and to continue to tear apart this bill and figure out what we're able to do and not able to do so we can continue providing care. Thank you so much.
Thank you, Erin. Really appreciate that. Now we're going to go over to TransOhio. I know they've got some really exciting things. Is TransOhio on?
I'm seeing Dara here.
Hi, folks. This is James. I am chair of TransOhio. And just recently, we announced the launch of our Trans Care Connect Warm Line, which is a peer-to-peer support hotline. It's a 1-866 number, so it is toll-free. You can call or text from any phone number, and you are connected to a trained peer who can talk to you about current resources and just be a listening ear if you need someone to talk to about what's going on in Ohio right now. We also have our emergency fund, which helps get folks care either in-state or out-of-state. And additionally, it provides funds for people who are looking to relocate out of Ohio. And we also just launched our Discord. For folks who are on Discord, please join. This is our new space for folks to connect with each other, to find care. And this is especially important for people in the more rural areas who may be outside of big cities and don't know where to reach community members. If y'all have any questions, please go to transohio.org or email us at any time. It's transohio@transohio.org.
It's really great. Thank you, James. Those resources are so critical right now. All right, we're going to move on to the Kentucky Health Justice Network.
Hey, y'all. I'm Oliver Hall. I'm the Trans Health Director for Kentucky Health Justice Network. Before I jump in, I just want to say that I'm really sad that we have to be here, and I'm sending a lot of love to families in Ohio and Kentucky. Mainly, our program helps trans Kentuckians access gender-affirming care through direct supports, healthcare and insurance navigation, transition mapping, financial assistance for gender-affirming care. We also maintain a resource page with provider recommendations and resources across the state. Since SB 150 passed in Kentucky, for those of you who don't know, that was our trans youth healthcare ban. We have been helping families access care in other states through patient navigation and support, including assistance navigating insurance. A good portion of those families have been accessing care in Ohio. And unfortunately, as the ACLU mentioned, Kentucky patients are not included in the exception that allows Ohio residents who have already initiated care to continue care. So we're continuing to do patient navigation for those families to identify alternative care options and ensure there's going to be no break in their care. With this, we're also offering gas assistance to those families. And as the Campaign for Southern Equality already mentioned, but they have those $500 emergency grants available to any of the families who have not already utilized those. And you'll notice there's a QR code up on the screen. The quickest way to get access to patient navigation, support, and gas assistance is to fill out that form that's linked. And you can also contact that email listed that goes straight to me if you have any questions or need any assistance. Campaign for Southern Equality also kind of already addressed this, but again, same is true for Kentucky patients. Make sure to get in contact with your current provider if you're seeing a provider in Ohio, just to make sure you can keep any appointments you have in the next 90 days and to see how far your current prescriptions will take you, so you know that the timeline you're working with to get alternative care. And with that, if you have a chance, just make sure that if you already have a therapist, to get an updated therapy letter, because that will kind of streamline the process to getting you into alternative care.
Thank you, Oliver. Whew. All right, now let's move on to the fairness campaign.
Hi, friends. Chris Hartman, he, him, Executive Director of the Fairness Campaign in Kentucky. And I just want to echo what Oliver said. This is so sad and a difficult, deeply troubling time for our movement. But I do believe that it will not last and that there are so many of us and so many of you here that we will endure this difficult moment and come out victorious. I just want to share that the Fairness Campaign, very much like our partners across the river at Equality Ohio, are continuing to fight anti-LGBTQ legislation in our state capital in Frankfort, and working closely with the Kentucky Health Justice Network, which Oliver represents, and so many others, to once again provide a front line of defense against further attacks that may be coming. And so I'll drop the Fairness Campaign sign-up list in the chat, as well as our legislative tracker that you can follow if you're in Kentucky and want to be able to advocate against some of the anti-LGBTQ laws that are still coming, or for some of the positive LGBTQ laws that hopefully one day we'll be able to celebrate. And on a positive note, tomorrow marks the 25th anniversary of Louisville's original fairness ordinance, which was the first in Kentucky and one of the first in the South to protect LGBTQ folks from discrimination in employment at that point in time. And so tomorrow we'll be celebrating by introducing statewide fairness laws in our Kentucky General Assembly for the 25th time. And so we've got winning on the horizon. I know that folks need love and support right now. And I know that our community is going to provide it. So thanks so much to the Campaign for Southern Equality for all you do, and all of these incredible partners, both in Kentucky and Ohio, for your tireless work.
Thank you, Chris. Oh, well, as everyone's saying, this is really heavy. So I want to take just a moment. Let's pause, take a breath. And I know for me, it gives me a lot of hope that we have these wonderful partners in the state of Ohio, and they are just providing incredible resources. And I know that we're all in this together. Now we're going to move on to the Q&A, which I want to remind everyone is not recorded. Adam, can you stop the recording?